Hi everyone. In this video, we are going to discuss about why occlusion is confusing, because it doesn't need to be. Occlusion is very simple to understand once you understand the fundamentals. But why dentists are so confused about occlusion? One of the reasons dentists are confused is because it's not very well taught in undergraduate program. There was a study done in 2018 which asked universities how many hours of occlusion they teach. Some of the universities did not have a separate occlusion module, and they used to teach occlusion as part of their individual discipline for one lecture maybe. So it's very unevenly taught. So it's not all the universities are teaching it at a very high level. Too much information, and it seems it's difficult to relate clinically. So it's very theoretical. And practitioners usually find it very difficult to implement that into practice. There are different opinions, people, when I'm teaching full mouth reconstruction, I prefer to go back to CR and start restoring teeth using CR position. However, I know some dentists who would do full mouth reconstruction in ICP. There are different of opinions and different variety of ways doing things. And that's why dentists get confused. My advice would be that try and learn one technique first, and then decide which technique, if you want to learn the other technique, and then after you learn both techniques, decide which one works for you. But for me, I've learned one technique and it works really well for me, so I don't feel any issues changing them. And also for me, when I'm teaching something to a dentist, I want to teach a foolproof treatment modality, not treatment modality which works maybe 80% of the time and doesn't work 20% of the time, because you don't know who those 20% of patients are in which these treatment won't work. So my aim is usually to teach something which is very predictable rather than it's easy. Having said that, once you know the fundamentals, it's very, very easy. So another reason occlusion is quite confusing is because there are different terminologies to describe the same situation. You have, one of the example is if you look at Glossary of Prosthodontic Terms of 1999, the CO is described differently than the current terms of CO, which is centric occlusion. We will go through about the terminologies in future videos, but if you're talking to someone who has learned occlusion in 80s, their meaning of CO might be different than the current meaning is centric occlusion. And you may be talking about the same thing, but you might get confused while you're discussing the treatment modalities. Similarly, when you read old papers, some of the papers might call CO, which is different than understanding of CO right now. So you might be looking at research paper which might be true at the time because they're using true terminologies, but not at current time. So there are different terminologies to describe the same situation. The scientific evidence is very vague, and with many things as dentistry goes, you will find contradicting scientific evidence. You will find scientific evidence that Michigan splint helps in relaxing muscles. You will find evidence that it doesn't. You will find evidence that face bow record is good when you're doing treatment planning, or when you're mounting models, it avoids more risk. You will find evidence that you don't really need to mount model on semi-adjustable or any articulator in order to do treatment. So there is no firm evidence suggesting the treatment modalities. And again, my philosophy is that if you learn one way to do that treatment, and if it works for you, then stick by it. Especially if someone's been doing that for years and that person's teaching you. Conformative dentistry works most of the time. And that's what we discussed in last video, that why you need to understand occlusion. Because most of the time conformative dentistry works really well, which means you're conforming to patient's current occlusion, and that works fine. However, when you are diverging from that and you want to reorganize, that's when you really need to learn about occlusion. And lastly, you really need a lot of hands-on practice in order to learn and implement occlusion. You can learn occlusion theoretical knowledge by doing online courses, but you need to have learned, if you want to really implement to a higher standard and learn quickly, you need to start implementing that into your daily routine practice. And that means, learning from your mistakes or calling in someone who then can help you and guide you while you're doing the assessment. So 3 tips from this video. The tip number 1 is remember that the occlusion is not as difficult as you think. Although people have tried to make it really confusing, it's not as confusing as you think. It cannot be as difficult. Learn correct terminologies to understand literature. So make sure that you are up to date with your terminologies in order to learn about the literature, because as I said, the paper might be contradicting themselves. And practice. Make sure that you implement those clinical skills which you learn in different courses or online and implement them straight away without forgetting. Otherwise, you will forget these skills within a week or 2 if you don't start implementing them straight away. So try and implement as soon as you learn that. Okay. In the next video, we are going to discuss about application of knowledge of occlusion in different clinical scenarios. I hope you enjoyed this video. If you have, please share it with your colleagues who you think might be benefit from this video. And if you have any question, feel free to contact me on social media or visit my website, which is www.drdevangpatel.com.